Hi, everyone. So I did a post on fever yesterday, and I thought this would be a natural conversation to talk about febrile seizures. The term for febrile seizures, some people say fever seizures. So, fever seizures or febrile seizures are seizures that occur in children due to a rapid rise in fever. This occurs in younger children, normally ages 18 months to maybe 5 years old. And again, it's due to the rapid rise in fever. So it's because the fever rises very quickly. And so preventative measures such as giving Motrin or Tylenol is not often useful. There are two kinds. There's simple and complex. Simple is where the child shakes all over. So what you think of as a seizure. So the child shakes all over and then the seizure is shortened in time. Complex is maybe you'll see a shaking of one arm or one leg and the seizure lasts for much longer. There is a chance of recurrence if your child gets a febrile seizure. So it's like a 30% chance it'll happen again in the future. And again, please know that giving Tylenol and Motrin isn't going to prevent it because it's the rapid rise from a neutral temperature to a fever. So even if the fever is just 100.4, it's going from normal to a higher temperature. What do we do about it? Well, of course, during the seizure, you want to make sure your child is breathing normally because during a seizure, the mouth relaxes. So you want to lay your child on the side during the seizure so that the child has no obstruction of their airway. That is number one. Do not put your hands in your child's mouth during a seizure. So roll them over onto their side, okay? That will relax the tongue and keep the tongue from obstructing the back of their throat. If the seizure is lasting and it feels like a really long time during a seizure. So, if there's a clock nearby, like take a glance at it. But, a 15-minute seizure is a long seizure. Okay. So, most of the time your child is out of the seizure by the time you seek emergency help. You do not necessarily have to call an ambulance if it's over within a minute. Okay. So a simple febrile seizure, you don't need to have an ambulance come to your house. If it's lasting, for 15 minutes, you probably do. And if there's any obstruction of the airway, obviously you do. That would be you're seeing blueness around the child's mouth. At the emergency room, if you do end up going, they're going to look for signs of neurological status problems. So in younger kids, if it's a child younger than 1, there's a higher chance that they'll do a lumbar puncture. They don't do this necessarily in every child who has a febrile seizure. How do we manage this as an outpatient? Well, we talk about what the febrile seizure is, and again, how to make sure in the future when your child is ill that you are prepared and make sure you know what to do. Do we send patients home with anti-seizure medicines? Most often the answer is no. Is there a chance your child has epilepsy in the future? It's a very small percentage, like 1% chance that your child has epilepsy in the future. So it's not a huge percentage of chances that this turns into anything other than febrile seizures. And once your child gets old enough, they outgrow the problem. Okay. Most often we're just looking for the cause of the fever. Okay. So I hope this helps. Again, the most important part of it is keep your child safe during the seizure. Don't put your hands in their mouth. Make sure they're on their side and breathing normally.